Ovarian cancer is one of the leading causes of cancer deaths among women. This year, it's estimated that about 21,000 women will be diagnosed. Some 13,000 will die. This morning, oncologist Dr. Scot Ackerman with the Ackerman Cancer Center is joining us this morning to talk more about this. Good morning. Thanks for being here. I appreciate it. First and foremost, are there any symptoms typical with ovarian cancer?
You know, sadly, ovarian cancer symptoms don't really occur until it's in a more advanced stage. So earlier tumors that are just forming, you really have very, very little symptoms. But when it becomes a little bit larger, a tumor or more advanced, you do start to have symptoms. These symptoms typically are bloating, just feeling a fullness. Women sometimes complain of gastrointestinal disturbances, change in bowel habits, maybe diarrhea, alternating with constipation. You could have changes in urination, just a full feeling in the pelvis, not feeling right, some fatigues as well. Vaginal bleeding doesn't happen often, but it could. And those are the main symptoms. I guess if it's a little bit more advanced, women may have a feeling of pain, pelvic pain or pelvic, as I said before, heaviness and fullness, but even some lower back pain.
Yeah, it's interesting because the symptoms that you just described, I would imagine women would ignore and assume that it's, you know, an upset stomach or something like that. And that given that, are there any people who are more at risk then of developing ovarian cancer?
Yes. So, but those symptoms also could be symptoms of a normal menstrual cycle.
Right,
too.
right, yeah.
So women who are at risk are women who maybe have some genetic predisposition or a family history of ovarian cancer. So if you have a family history of ovarian cancer, then you're a little bit more susceptible. If you have a history of breast cancer, women with breast cancer have a higher risk of ovarian cancer, even without a genetic predisposition. We call it hereditary breast and ovarian cancer syndrome. But also there's certain genetic predispositions to ovarian cancer. You've heard of the BRCA gene, BRCA, so there's BRCA1 and BRCA2. These genetic screw-ups in your genes will put you at higher risk for not just breast cancer, but for ovarian cancer as well, and even endometrial cancer and pancreatic cancer. So if you have a family history of ovarian cancer or breast cancer, if you have BRCA1 or BRCA2 inherited gene, you'd be at a higher risk for breast cancer.
So can you get, is there testing then that can be involved in terms of genetic testing that can allow this, and do you offer that?
Yes, we offer that in our office, but most oncology practices and even primary care offices, you can speak to your doctor about that. There's genetic testing that can be done, but typically it's done after we do a screening. We don't do genetic testing on everybody because some women are at such low risk of having a gene mutation that it's really not worth doing that testing. So first we do like a simple screen, and we ask a woman about her family history of cancer, her personal history of cancer, whether her mother, her father, aunt may have had certain cancers, and it goes into a whole algorithm. And then that tells us if the woman has a substantial chance of having a genetic mutation. And then we do the testing on those women. And the testing is simple. It's a blood test or even a swab of the cheek.
And is that typically covered then by insurance, or is it expensive?
It's only covered by insurance if there is a significant risk of having a genetic mutation. So that's why we do that first pre-screen. And if a woman, or a man too, we do genetic testing on men as well, because the same BRCA testing puts a man at risk for breast cancer and also at risk for prostate cancer and pancreatic cancer. But once a patient, goes through that pre-screen, and which shows them to be at significant risk, generally those are covered by insurance companies.
Dr. Ackerman, thank you for your time here this morning. We appreciate it.
Thank you, Jen.